गुड इवनिंग, अस्सलाम वालेकुम, सत श्री अकाल। मैं हूँ आपकी होस्ट सारा अंजुम हेल्थ मैटर्स के एक नए एपिसोड के साथ ब्रॉट टू यू बाय पावर मीडिया एंड मार्केटिंग। राइट, आज का जो हमारा एपिसोड है वो है डायबिटीज़ और ओल्डर पेशेंट्स के ऊपर। व्यूअर्स, आज के जो हमारे डॉक्टर हैं वो हैं डॉक्टर हुसैन। आए उनसे हम बात करें। थैंक यू डॉक्टर हुसैन फॉर कमिंग टू आवर शो।
You're welcome.
डॉक्टर, टेल अस व्हाट इज डायबिटीज़?
Diabetes is a sugar disorder, basically the problem with the insulin which is produced in our body. Those who have diabetes, they cannot make enough insulin, or they have insulin, it cannot work properly. So in our body, sugar level goes higher. So that is and then patient presents with the symptoms, and this is the diabetes basically.
जी डॉक्टर साहब, ये बताएं कि डायबिटीज़ के सिम्टम्स क्या हैं?
Okay, so basically the two types of diabetes.
जी.
So one is type 1, one is type 2. So elderly people like around 40 and plus, mostly type 2 diabetes, and they presents with thirsty, they feel thirsty, and they go to the bathroom more often, they have to go, and they have headache, they have dizziness, and sometimes palpitations, they are not sleeping well, and also losing weight. So they initially present to the doctors with this kind of symptoms, then we go and check the blood work, and then we find the diagnosis. Then.
How can we prevent diabetes?
Okay. The most very important things we have to prevent,
Yes.
rather giving the treatment.
Yes.
So prevention is better than the cure. And the most important thing is the diet. Number 2 is exercise, and also some lifestyle modifications. So diet, we have to watch for the diet, especially Bengali, Pakistani, and Indian communities.
Yes.
We mostly eat rice and the rotis,
Yes.
you know, and sweets most of the times, but we have to cut that down. We cannot avoid food, but we need food to survive, to get the energy.
Yes.
But we have to watch everything: low cholesterol, low fat, low carbohydrate, and flour we have to avoid because that converts to carbohydrate and giving us glucose,
Yes.
sugar, it causing sugar level high. So we can do one thing. We can reduce our rice, at least we can take one time, once a day, and we can take our dinner at least 3 to 4 hours earlier than going to the bed. And we have to do exercise every day, minimum 5 days a week, and also we can take fruits, salad in our diet.
Yes.
So that way we can actually prevent the diabetes.
Yes. Dr. Hossain, tell me, how serious is diabetes?
Okay, diabetes is equivalent to heart attack. It's called myocardial infarctions.
Yes.
So it is very serious if we don't control it. So most important thing is prevention that we just mentioned. So prevention is very important. If we don't prevent, then it affects our brain, causing stroke. It affects our eyes, causing blindness. Heart, cause heart attack or myocardial infarctions.
Yes.
Affects the kidney, causing kidney failure, and also decrease the circulation of the lower extremities, lower legs.
Yes.
It's causing, then we have to do amputations finally. It's causing neuropathy, food disorders, you know. So multiple organs it causing problem if we don't control properly.
Yes. डॉक्टर साहब, ये बताएं कि थोड़ी देर पहले आप कह रहे थे कि there's a type of diabetes. There's type 1 and type 2. वो क्या है?
Yeah, actually type 1 is called juvenile. Juvenile means early onset. Young people, they may have. And type 2 is adult onset, those who are adult. Sometimes those who are obese,
Yes.
they develop diabetes type 2. So type 1 is insulin deficiency, means there is no insulin, not
Yes.
producing. Insulin is produced by our beta cells in the pancreas. There is an organ.
Yes.
And in type 1, there is no insulin. In type 2, there is insulin, but insulin does not work properly. So that's the reason that our blood glucose level goes higher. And to work properly, that glucose should go to the cell. Insulin does that actions, but
Yes.
insulin cannot do work properly. That's why sugar level goes higher. And these two types of diabetes we have.
So
And
doc-
another diabetes we have, it's called gestational diabetes. It's related to pregnancy. So that is different part.
Okay. So doctor, these were questions about what is diabetes and what are the symptoms. Can you please tell our viewers that where did you get your education from?
Actually, I completed my medical schools in Bangladesh. I was born in Bangladesh and grew up in Bangladesh. And 2002, end of 2002, I came here, this country, and I did internship, residency at
Yes.
Brookdale Hospital, internal medicine, and also I did fellowship 1 year Montefiore Hospital at Bronx for the geriatric medicine for elderly people.
Yes.
And then I joined Long Island North Shore Health System.
Yes.
Currently, I am the attending physician, Long Island Jewish Medical Center, as well as also I have my own practice. Name is Right Care Medical Office
Yes, doctor.
in Queens, and also I have a website rightcaremedicaloffice.com, RITECARE, rightcaremedicaloffice.com. If anyone can go and see details, they can
Yes.
go and see our website and get more information.
Right. Thank you, doctor, for sharing a little about you. My next question is that how is a patient diagnosed with diabetes?
Okay. The initially patient presents to the doctors with the symptoms, those who are not going to the doctors routinely.
Yes.
So symptoms I already mentioned.
Yes.
And when they come, we check routine blood works like hemoglobin A1C, fasting blood glucose, and also we check cholesterol and all other labs. So we get, if hemoglobin A1C is more than 6.5, then it's called diabetes, or fasting blood glucose more than 126, then it calls diabetes.
Okay. डॉक्टर सर ये बताएं कि अगर किसी पेशेंट को डायबिटीज है, are they on a risk for other medical problems as well?
Of course, because again, initially I told diabetes equivalent to heart attack.
Heart attack or stroke as well.
Stroke, it is the complication of
Yes.
diabetes if not well controlled. So diabetes can cause blindness. Diabetes can cause heart attack and renal failure and all other organs.
Yes.
So that is important that we have to routinely monitor our eye exams, kidney function, and all other tests. At least annually, once a year, we can check, and then we can prevent also the
Yeah.
diabetes.
Dr. Hossain, a while ago you were saying about blood sugar, that it goes high or it doesn't make enough. What exactly is blood sugar?
Okay, blood sugar is the sugar that we are, in the market you can buy and you see the sugar.
Yes.
That we are not eating sugar basically.
Yes.
We eat food that contains fat, that contains carbohydrate.
Yes.
So that goes to the liver, the needs in the body, that the excess amount it is storage as a storage, it stays there, and it converts to carbohydrate. Carbohydrate converts to glucose.
Yes.
Sugar, carbohydrate
Yes.
converts to sugar. So sugar there is a glucose and fructose. So basically sugar coming from the food, fat, carbohydrate, all other
Yes.
food that we are eating, that is converting to the sugar.
So the people who have high sugar or low sugar, how often should they check their sugar level?
Okay. High sugar basically is the diabetes. Low sugar usually patient presents those who have diabetes and they are
Yes.
taking either insulin or medications and not taking enough food. They present sometimes with it's called hypoglycemia. High blood sugar, basically, those who are taking insulin, they have to monitor at least 4 times a day with a regular coverage.
Yes.
Those who are not taking insulin, usually on medications, oral medications, they can take every 3 months, they can check, go to the doctor, they can check the hemoglobin A1C and fasting blood sugar. So it depends on, if more stable, then twice a year. If very mild, patient is stable, nothing, then once a year we can check at least hemoglobin A1C and fasting blood sugar.
जी डॉक्टर साहब डॉक्टर साहब ये बताएं कि जब इंसान की शुगर हाई होती है लो होती है what are the symptoms to that?
Thank you. That is important. We have to know. Hyperglycemia means high sugar is better than the hypoglycemia because our brain needs sugar, glucose. If it does not go there, then you may become confused and you may have fall. So you have consequences of fracture, bone, you know.
Yes.
So then a lot of things will come if you have hypoglycemia. So the symptoms you're asking me, the symptoms patient may have dizziness, sweating, palpitation, tremor,
Yes.
and they have shakiness, tremor, shakiness,
Yes.
and they become very confused and they fall.
Okay.
So these are the hypoglycemic symptoms.
So the hyperglycemia is the high when they have high sugar.
High sugar, and
Okay.
they also present like they have headache,
Okay.
they have blurry vision,
Yes.
and they have some shakiness, not that much, and they are going to the bathroom more often, more urination. And if you check urine, you see the glucose in the urine.
Right.
And sugar, of course, is high in the blood too.
Yes. Dr. Now it's time to take a short break. नाज़रीन हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद आप हमें हमारी ईमेल पे कॉन्टेक्ट कर सकते हैं जो कि है healthmatterslive@gmail.com